Morning. Hi, I'm Wendy. I'm Dr. Wendy Knopes. I am a doctor with an interest in women's health. I've been asked to come and speak to you a little bit about my experience and journey with menopause. I've been asked to come and explain a little bit about my background, but unfortunately, as you can tell, I'm not there in person today. I am currently isolating with COVID, but I hope to be with you at the next event and get to meet lots of you in person. To give you a little background about my own clinical experience, I trained as a GP, and at that time I developed an interest in women's health, so went to work in something called sexual and reproductive health, which has a focus on community gynecology, so women's health issues. As part of that is contraception, but sexual health is part of it too, as well as menopause care and other aspects. I'm also currently training with the British Menopause Society to obtain my certificate, and I attend lots of forums and keep up to date with menopause training as my own special interest. Currently, I am working at Rock Clinic, which is a private clinic in West Hill, setting up a women's health service where women can access all aspects of their women's health problems. Now, it may not be related just to menstruation, it may be related to fertility or contraception, or it may be now with incontinence or menopause issues. So it's all different aspects of females' health issues existing under one area. But more interestingly, the reason I've been asked to talk to you is my own personal experience with menopause, and that started in 2014 when I was diagnosed with breast cancer. And at that point, that was a very difficult diagnosis, having to deal with that, being in my late 30s with a 2-year-old and a 4-year-old, and a partner who was currently still training in his hospital specialty. That aside, I had to deal with the whole cancer diagnosis and all the treatment and everything. I wasn't prepared for the after effects. So I was informed about what to expect for side effects with chemo or radiotherapy or surgery, but it was the after effects of menopause and the debilitating symptoms really that existed for many years afterwards that were quite a struggle and quite difficult for me. I sought help and I asked healthcare professionals and colleagues about advice, and I found that a real struggle because I felt nobody really understood. Nobody really could give me what I needed personally. Everything was restricted due to the fact that I had a cancer diagnosis. And so my journey personally through menopause symptoms and having, debilitating symptoms that affected my daily life, learning how to live with them and learning what worked and what didn't work, was very educational, not just for me but for others. And this is the part that I would like to share with women who are going through a similar experience. Just to recap for those that are not familiar with the term menopause itself, what it means, it is a definition of just when you have your last menstrual period. It's a time when your ovaries lose their reproductive function and you get a drop in your estrogen hormone. But it is a retrospective diagnosis and nobody knows exactly when that is going to happen for them. It can happen at any age. The average age is 51 or 52, but the usual most common range is between 45 and 55. Although there are a significant proportion of women who have menopause much earlier than that. And if it's between 40 and 45, we call it early menopause. If it's before the age of 40, we call it premature ovarian insufficiency. And there's a range of symptoms that can happen, and some women cope much better with it, have less severe symptoms, while others have quite significant symptoms. And I find that women who have had surgical or medical menopause actually have the most severe symptoms. They are suddenly stripped from their own natural estrogen production from one day to the next, and then are drastically put into menopause without a gradual change. And the symptoms can be quite debilitating and severe. So about 70% of women do have symptoms. So not all women have symptoms, and some women do get by without having without having any issues with menopause and not many symptoms. But what happens really with menopausal symptoms is in the perimenopause, so around the time, or this could be years before the menopause, women have fluctuating hormones which then cause all sorts of fluctuating symptoms, so unpredictable symptoms and symptoms that they have no control over. They could be physical. I'm sure we could name a few physical symptoms off the top of our head, but it's not just limited to physical. There are sexual symptoms and psychological symptoms that are quite severe for some women as well. So this image I have taken from the Women's Health Plan, and this shows the most common symptoms women experience, and most of us can probably relate to all of these at some point, but some of us may not realise that things like tiredness or anxiety with palpitations and panic attacks is actually a symptom of the menopause, or that memory loss and brain fog actually is related to menopause. And I've heard women say, well, I think I might have early dementia, or I might have depression, or something like that. And in fact, it's actually at that time in their life where the ovaries are not performing in the same way, and therefore the hormone fluctuations are causing these symptoms. And it's just being aware that although they overlap with a whole range of other causes, it can be the menopause that could be causing these symptoms. So for me, my own journey was quite difficult in having to access the right advice and support. And all I really wanted was somebody to understand what I was going through, understand my symptoms, without having to constantly tell me, well, you can't have this because you've had cancer, and you can't have that because it'll bring your cancer back. And actually looking at me as a person and my symptoms that were quite debilitating and affecting my daily function, and looking at what could actually help and what was better for me in the long run. And so I went on my own journey to find the right information by doing my own research, speaking to different healthcare professionals, and talking to my very supportive partner and family about what I was prepared to try, knowing fine well that the advice states to avoid at all costs in case there is a recurrence of cancer. And so I tried various things to see what would work, and some things didn't and some things did. And it's just being able to work out the right way and the right treatments for you as an individual. And so I am quite keen on supporting women through menopause, and in particularly the ones that have the most severe symptoms, particularly with surgical and medical menopause, and just allowing them to share that information with each other, but also the healthcare professionals, because I think the healthcare professionals need a bit more awareness and education about what symptoms women go through, We don't tend to discuss them with our friends. We don't tend to discuss them always with our GP. And when we do, we find we don't know where to look for information. So I would like a place where women can come to discuss these issues. And I think that is already developing amongst different forums and different networks. But ideally, I would like something within Aberdeen and Aberdeenshire for women to have a place to go to and ask for help. And for women to then make their own informed choices on treatment and management. Now, the Women's Health Plan, I briefly mentioned the title in an earlier slide, and it is really a plan that the NHS and the Scottish Government are hoping to put in place over the next few years. Is really from an overall perspective of women's health care, to improve education, improve access, make it fair for everybody, whatever age, whether they're a girl or a woman, and whatever stage in their reproductive life. In particular with menopause, they make a mention about improving access to specialists, as we know that is lacking, or there's a time delay, a long waiting list, and also educating our healthcare professionals on, particularly GPs in primary care, to be able to manage menopause symptoms for women locally, and also allowing women to be able to share their symptoms and look for advice and information themselves to make the right decision. So where would I ask you to look for information to begin with? These are the websites I've been recommending to patients in the past, and Menopause Matters and Women's Health Concern have been around for some time and have very useful evidence-based information out there in small parts, small sections, linked into the British Menopause Society. So reliable, accurate information and up to date. However, there are other websites, and there are many that may be useful. The two that I've found useful and interesting are Rock My Menopause, which is more about sharing of symptoms and recognising menopause and just making women more aware of what menopause is. But the more useful information I find in Balance, and this has been designed by a menopause specialist in England called Dr. Louise Newson, who has made a huge range of patient information leaflets specific to many different clinical issues, and that might be for women who have a family history of breast cancer or osteoporosis, or actually have had breast cancer. What do they need to do, or what can they do about menopausal symptoms, etc. So this is the more up and coming, latest, newest website, which is also very reliable and has good, solid information for patients out there. It may be a little bit overwhelming to begin with, but it is quite a good resource to use. Hoping that in the future we'll get a little bit more about where to seek help locally, and where to get advice about menopause, and hopefully I'll get a chance to be involved in that, and particularly in person to meet all of you next time. So thank you very much for listening to my talk today, and hope to see you soon.